Welcome to the compliance tip on ABNs, medical necessity, and Medicare rules, presented by the American Institute of Healthcare Compliance. What is an ABN? An ABN, if you're not familiar with it, is an advanced beneficiary notice, also known as a waiver of liability. It's part of the Beneficiary Notices Initiative, or BNI program with Medicare. Both Medicare beneficiaries and providers have certain rights and protections that are related to financial liability and appeals under the fee-for-service Medicare and the Medicare Advantage programs. Providers are called notifiers. The notifier may direct an employee or a subcontractor to deliver an ABN. The billing entity will always be held responsible for effective delivery regardless of who gives the notice. Now, when multiple entities are involved in rendering care, it's not necessary to give separate ABNs. Did you know that? Either party involved in the delivery of care can be the notifier when, number one, there's a separate ordering and rendering provider. For instance, a physician orders a lab test and an independent lab delivers the tests that were ordered. Number two, one provider delivers the technical and another the professional component, such as a radiological test where an independent diagnostic testing facility renders and a physician interprets. Now, the entity that obtains the signature on the ABN, when it's different from the entity that bills for the services, that would be like one laboratory referring a specimen to another laboratory, which then bills for the Medicare test. Our session today addresses Form R-131. Now, there's more information than what we can go over, but I am going to give you a reference for the Medicare Claims Processing Manual where you can download specific instructions. The Advanced Beneficiary Notice of Non-Coverage, Form R-131, is issued by providers, which includes independent laboratories, home health agencies, and hospices, physicians, practitioners, and suppliers to original Medicare fee-for-service beneficiaries in situations where Medicare payment is expected to be denied. And typically, an ABN is executed when it's going to be denied as not medically necessary. The ABN is issued in order to transfer potential financial liability to the Medicare beneficiary under certain circumstances. Guidelines for issuing the ABN can be found beginning in Section 50 in the Medicare Claims Processing Manual 100-4, Chapter 30. When you're executing this R-131 form, you need to do it according to the Medicare guidelines. There are some compliance steps, and if you're inexperienced or this is new for you, I suggest you download the guide and follow it to the T so you don't make any mistakes, because compliance is required. The ABN can also be used to provide voluntary notification for services that are never covers. So when the ABN is used as a voluntary notice, it's usually because the beneficiary doesn't choose an option box or sign the notice, or CMS has issued detailed instructions on the use of the ABN in its online Medicare Claims Processing Manual. Completing the form with the patient is required in advance, thus Advanced Beneficiary Notice. So this way, the patient is making an informed decision regarding financial liability before the fact. Answer all the patient's questions about why Medicare may not pay and the associated costs. So as you can see here, you need to put Medicare doesn't pay for D, and then D would be repeated here and explained here. I would suggest putting a CPT code, but you have to do more than just the CPT code. You have to give a description in layman's terms so the patient understands what they're signing. And then the reason they're not going to pay. A lot of times that's going to be from a local or national coverage determination. If you want more information on where to get that information, look at one of the previous YouTube videos that we published on local coverage determinations. And then the estimated cost, or the charged amount the patient is going to end up paying. Section G is completed with an X. So the patient chooses an option 1, option 2, or option 3. Most of the time, the patient and the doctor have discussed it, and they're going to want to have the service. You may ask to pay now, but I also want Medicare billed for an official decision on payment, which is sent to me on a Medicare summary notice. I understand that if Medicare doesn't pay, I'm responsible for payment, but I can appeal to Medicare. Now you can assist with that appeal on the behalf of the patient if you want, but more often than not, it's going to be usually pretty clear that there are extenuating circumstances in regards to the patient's condition, frequency, or other circumstances that would cause it to not be medically necessary. Now, if they could choose option 2, they want the service but don't bill Medicare, and they know that they can't appeal if Medicare is not billed. And option 3, they're actually stating they don't want the service listed above, and they understand that they're also not going to be responsible for payment. Providers are responsible for determining who may act as a beneficiary's authorized representative for the purposes of ABN issuance under applicable state and other laws. An individual who may make healthcare and financial decisions on a beneficiary's behalf would be their legal guardian or someone appointed according to a properly executed durable medical power of attorney. If the beneficiary has a known legally authorized representative, the ABN must be issued to the existing representative. If a beneficiary doesn't have a representative and one is necessary, a representative may be appointed for purposes of receiving the notice following CMS guidelines as permitted by state and local law. So you're going to have them sign here, they're going to date it, and it needs to be the appropriate party that is signing this. Now, what happens if the patient refuses to sign, or the durable medical power of attorney or the responsible party? If the beneficiary or their party refuses to choose an option and refuses to sign the ABN when required, you're going to annotate the original copy of the ABN indicating the refusal to sign, or choose an option and may list witnesses to the refusal on the notice, although this is not required. Per Medicare, if a beneficiary refuses to sign a properly delivered ABN, your office should consider not furnishing the service unless the consequences, such as health and safety of the patient or civil liability in case of harm, are such that this is not an option. We suggest consulting your risk attorney through your malpractice insurance company prior to not furnishing care ordered by one of your providers for financial reasons. Comply with all the guidelines. And you do want to download Manual 100-04, Chapter 30. Blanket ABNs are not permitted. A blanket ABN is where you have just everybody sign an ABN just in case. Having patients sign a blank ABN is not permitted, and so those ABNs could be thrown out as not being valid. When it comes to having patients sign, you need to have a minimum of 2 copies, including the original, which you should retain, and the beneficiary gets a copy. The ABN form must not exceed 1 page in length. However, if you want additional information, you can have attachments, but it has to be just for listing additional items and services. If attachments are used, they must allow for clear matching of the items or services in question with the reason and cost estimate information. The ABN is designed as a letter-sized form, so if necessary, it may be expanded to a legal-sized page. Retain at least for 5 years or as required by state law, even when the patient declined care, refused to choose an option, or refused to sign the notice.
Consider learning more about healthcare compliance with the American Institute's online on-demand training courses. Visit our certification store. Check out short courses and webinars. Both links are provided in this video's description below. Questions? Contact us 330-241-5635 or visit our website www.aihc-assn.org.